The objective of our study was to look at the prevalence of the COVID-19 infection during the COVID-19 pandemic and the proportion of people living in the slums taking the vaccines as well as the non-slum surrounding areas. And we also wanted to differentiate between adults and children, whether the vaccination was better or not. So what we found that people living in slum areas were less aware, or they had more problems or difficulties in going to the vaccination center, taking the vaccines. They had more challenges. But the non-slum areas, they were more educated and they had more knowledge about, awareness about this. So the proportion of people living in non-slum areas had higher rate of vaccine intake compared to the slum people. And we also found that children or adolescents living in non-slum areas had higher intake of vaccine compared to the slum children. And the findings are that, the take-home message from this is that we should build awareness among the population, and this can be done by, in the villages probably by union parishad, and in the cities probably by the government, surrounding government wards who can give information to the slum people by making home visits by Shasto Shibika or something like that, or doing the miking, and then make them aware that how they can get the vaccination. The good thing was about mass vaccination. This helped a lot because poor people didn't have birth certificate or NID, so it was very difficult for them. So this was good, but for children it became a bit difficult because the schools did not inform them. During the pandemic, schools were closed, so slum children did not have access to this information. So that is why the vaccine intake was lower in slums. So here also, if they could, use the forces to inform the families by miking or somehow through the different NGOs to inform that, so that they can go to the school and get the vaccine.